So I'd been a social worker for many years. I had graduated with my bachelor's in 1989, and I worked in the field for some years, kind of frontline mental health work, and as a care manager. Went back for my master's and graduated in 1997 with my master's. Started doing some private counseling, private therapy, and working for some organizations and hospital organizations. And then in 2015, a lot of things came together at once, starting with coming back to Hartford Healthcare, an organization that I had worked for previously. They were interested in starting an integrated care program. They asked me to come back to work in this program. At the same time, I met Steve Lee, who was in the program, and he introduced me to the program, and he loved it, and he was getting ready to graduate. And there was a centeredness and a groundedness with Steve, and I thought, oh, that's really interesting. I'd like to understand what that's about. How did he get here? And he said, you really have to try out this program. It's really wonderful, and I think you'll like it. So I spoke with Kara English one day over the computer, and she was so supportive and so welcoming, and helped me to see how strategically, systematically I'd be able to get through the courses, and laid out the whole plan for me and helped me to see how I'd be able to accomplish it. It's been tremendous. I've learned so much about what really integrated care is about. And when I started out in the program, I was working in two of our primary care offices as the behavioral health clinician in these two primary care offices. So now that's grown. I'm now the manager of the program 2.5, 3 years later. And I have 12 offices, so I have clinicians that are working in 12 offices, and we're about to expand into 4 more of our offices. So we own 42 primary care practices within our organization, and my organization has made a commitment to put behavioral health clinicians into all of our 42 practices, and so that's where we're growing toward. And we wouldn't, I mean, it is all about integrated care. We wouldn't be able to do it without what I've learned here at Cummings, and I wouldn't be the manager of this program if I hadn't come to Cummings. It's the only care that makes sense. You know, the separation of mind and body care, doesn't make any sense. And the fact that we're caring for people under one roof, our outcomes are tremendous. We have a tremendous improvement in depression and anxiety screenings. We have a significant reduction in emergency department utilization, all-cause inpatient hospitalization, and our providers, our primary care providers, are very satisfied to have this help right in their office with them. So it's tremendous. Well, the lack of integrated care touched my family in a personal way. So my nephew is now 16, but my nephew has profound autism, and when my brother and sister-in-law, who are both medical professionals, brought their son to their pediatrician, and she'd been a pediatrician for many, 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 many years. And my sister-in-law said, you know, Michael's walking on his toes. Is that anything to be concerned with? And the pediatrician said, no, you just need to get him other shoes. As opposed to if there was a behavioral health clinician in the practice, certainly that person could have run some tests and been able to diagnose autism at a much, much earlier age. He finally was diagnosed by about the age of 3.5. If he had been diagnosed 1.5 years earlier and treatment had been started 1.5 years earlier, his outcomes may have been better.